Hi everyone, welcome. I'm here with lovely Dr. Sadaat. I'm Nurse Yalda here in LA. So, Dr. Sadaat, go ahead.
Hi everyone, I'm here with Nurse Yalda. We haven't seen each other for a while. We're here at Four Seasons Hotel, this beautiful hotel in Beverly Hills, California. We're at LAMCA, which is a multi-specialty meeting. We've learned so much and talked about so many different things. There's so many people here, more than 250 people with different backgrounds. And we thought that we just do this just to have fun.
Absolutely.
And answer some of the questions that people have asked us. There's so many hot topics in the field, and hopefully you will benefit from this. So what should we talk about?
So basically,
What's
the hot topic, right?
What is the hottest thing? What is the hottest thing?
So basically, our goal is to share our knowledge with you guys. I took a wonderful cadaver course with Dr. Sadaat 3 months ago, and I admire his work, his passion, and basically what we talked earlier today was about a couple topics. One was temple and temple injection. We're going to go over why it's important. The second one will be, did you guys know you have an option to do a non-surgical rhinoplasty? Not necessarily you have to go under the knife. And
right.
This lovely surgeon is going to go over that with us. And then number 3 is just going to be whatever you guys want to know. And
send us questions. We have about half hour, 30 minutes when we can answer all the questions. So one of the main things that we have learned recently, and it's becoming more and more popular, is that as providers injecting and doing fillers and doing all these treatments, we are learning the anatomy a little bit better, so we're safer. So we're doing, obviously you can't look under somebody's skin as they're live, so we use cadaver specimens. These are people that are gracious enough to donate their body, and I have a lot of courses like that, and Yalda was involved in that, which was great, where we inject the fillers and look underneath the skin and to see where we injected. Are we safe? Are we doing a good job? Are we creating beautification the way we want it or not? So one of the main things that are going on right now in the community is injecting fillers in the nose, and it's becoming really popular. I do a lot of surgeries for the nose, and it was fantastic. When I do surgeries for the nose, it's fun to do. I can make huge changes, but as most of you guys who've had rhinoplasty know that, when you do a rhinoplasty, you have to go under anesthesia, there's recovery time, there's downtime, there's swelling,
and
there's complications,
there's
bleeding. There's no guarantee. It's sometimes it's not completely perfect, even though I think that I can create a perfect nose when I do a nose job. Obviously I can.
Of course.
I'm a surgeon.
Dr. Sadaat, absolutely. 100%.
My results are perfect. It is, but sometimes it's not. Little things happen, and we have this beautiful advantage of using filler, kind of like Restylane, Juvederm, all the other products, hyaluronic acid fillers that are fully reversible, that we can camouflage and use this optical illusion to make the nose look much, much, much better. It's a simple thing to do. It takes a tiny little amount of filler. It's about 10-15 minutes. It's very artistic, and we can do a lot of things. We can camouflage a bump on the nose by adding a little bit here, a little bit there. We can make asymmetries better. We can make, if the side walls are indented, we can improve them. If the side of the nose is too far up, we can bring them down. We can add volume to this area. We can project the tip. We can lift the tip. There's so many different things we can do, and it's easy to do, and it's stageable, meaning that I can do a little bit, have you come back in a week or two, do a little bit more, have you come back in a week or two, do a little bit more. So it's very titratable, and it's so nice to do, and you bypass all the surgical downtime, the expense of surgery, the bruising, the swelling, all of those things. So
basically, for all the lovely women, with makeup, it's all about contouring. The power of injectable is basically we're giving you something that it lasts much longer. When you do your makeup, you try to project the tip of your nose. You're trying to make it more like even and soften it. So we could achieve that with just 10 minutes, 15 minutes of a treatment. As Dr. Sadaat mentioned, it's with hyaluronic acid. I know there's a lot of discussion out there that is it safe to have a non-surgical rhinoplasty. In my humble opinion, if you go to a professional who has been doing it for a long time, and there's not a safe area of injectable, but I would still say that it's one of the areas that is doable without going under the knife.
Well, I'll second that, and I say that that's one of the courses that we had here. We come to courses like this all the time. You and I attend the courses like this all the time
in the past 3
to
months,
learn how to be safer, how to be better, how to come up with better outcome. The other thing that a lot of people ask is that can it be done as a primary rhinoplasty? And of course it can. You can just see the preview of how your nose would look. So we do that, and then one of the other things that came up today or yesterday when we were doing a live injection was that, how do you add a filler making the nose bigger? I want my nose smaller.
Yeah.
And I think the key is what you just said. She said it beautifully. Those of you who use makeup, you contour the nose, and by using contouring and this is like a optical illusion. Even though you're adding filler to the nose, you're making it bigger, but if it's done correctly, you're actually making it smaller. You're lifting the tip. And believe it or not, you gotta go to my Instagram, and I'm sure you have some on yours. Go to our site and look at the before and afters. Look at how we have changed the nose by just adding fillers. And honestly, they look smaller. Even though we're adding the fillers, they look smaller.
So basically the goal is to create a balance. You want to make sure your nose is matching your lips is matching your chin. There are different ethnicity. Like one of the common patients that I do see is a lot of Asians that come to me, and it's very typical that they don't have a bridge. And believe it or not, by just adding a limited 0.2 ml of filler to the bridge, we're able to create a beautiful contour. And by that, we can, project their beauty. So to me, it's all about creation of balance.
Obviously technique is very important, science is very important, safety is very important, but at the end of the day, it's an art.
It's absolutely an
So
art.
it's all an art. Makeup is an art, contouring is an art, surgery is an art, injecting fillers is an art, balancing the face is an art. So we take classes all the time. I've been doing this for 20 years, and I keep taking classes and taking classes because I'm learning. I'm still learning. I want to keep learning. I want to improve myself. So are you. You've been doing this internationally. She travels the rest of the world to do this learning stuff because the more we learn, the better we can treat you guys, our patients, and the more we learn, we can teach our nurses and PAs and nurse practitioners and other doctors to get better results.
And I think one piece of advice I have for whoever is watching this Instagram Live, whether you're a nurse injector, whether you're a surgeon, education is the key. During this collaboration, you will learn from your other colleague and you share your knowledge. And I think knowledge is powerful. It doesn't matter how many years you've been doing this, you can always learn.
So learning is the key. So were there any questions there?
One person asked, what can clients do to make their Botox or filler last longer?
Great question.
Yeah.
What
Well, basically, as far as Botox or filler, Botox or any toxin usually lasts about 3 to 4 months. It really depends also on the patient metabolism. If you're just burning everything very quickly, your body will be different. However, as far as the filler, also I believe it lasts on how many syringes was injected. If you're trying to achieve a chin or jawline, if you're doing just one syringe, it's not going to last you, compared to someone who has 4 syringes. So I think the quantity is what matters. But with toxin, it's about 3 to 4 months.
Well, 3 to 4. Well, no. Yes, you're right. But we had a wonderful course this morning, that they were talking about how we can make the toxins
last longer.
Botox last longer. And the course was that if you make it more concentrated, not so dilute.
Yes.
So we're all doing that. I have changed my concentration in the past year or two to more of a concentrated one. And the more concentrated you make, it lasts longer. That's one thing. Second thing is, unfortunately, a lot of people out there think that, I'm just gonna get 5 units or 10 units and spread it over there. We know that dose equals duration, meaning that if you do 20 minutes, 20 units, it lasts longer. If you do 30 units, it lasts longer. If you do 40 units, it even lasts longer. So my recommendation is that time is very important. Your time is important, my time is important. Don't waste my time, don't waste your time. You know, I hate to say that, don't cheap out. Pay for more number of units so it lasts longer, so you don't have to come as often. And I think it's a bit similar thing when it comes to fillers, because fillers, you know, back in the day, we only had 1 or 2 fillers. Now we have over 250 fillers, and each filler is different. So you want to go to someone like me or you, where we have great knowledge about all different types of fillers. We call them rheology. Rheology means the characteristics of the filler. And each filler has a different characteristic. Some last longer, some are softer, some are more superficial, some are done more deeper, some work better in some areas versus the other areas. So we have all these things in our armamentarium, and we pick and choose which one is better for that particular person, that particular location on the face, and the longevity of it. Sometimes we want to use fillers that don't last that long because we just want to see how it looks. And then if that lasts long enough, then we use a filler that lasts longer. So you want to go to, so to answer the question is, higher concentration of the Botox or the neurotoxins, more number of units to make it last longer. Go to a practice that has a lot of experience with different kinds of fillers and understand the characteristics of the fillers so we can make them last longer.
Absolutely. And one thing I have noticed, I'm sure LA is the same area, where I'm from, in the DMV area, this area, I see different nationality. And I think that's something so important. You have to consider that anyone with a different nationality will require different type of a filler, different treatment. Like I use myself as an example. My background, I am Iranian. I do have a thicker skin. So therefore, I'm going to treat myself perhaps differently than someone who is like my husband, who's Caucasian. He has more like a thinner skin. His skin is more like fragile. So you have to consider that it's not a cookie cutter.
It's not one size fits all. It doesn't work that way.
You have to know who your patients are, if they have a great skin quality. So all this are very important to consider.
Beautifully said.
And one thing I'm a very big advocate when it comes to skin and skin quality, you guys. My background, I was an esthetician, and in my humble opinion, I believe when your skin looks great, your makeup is going to look great, your plastic surgery is going to look great, your face, your fillers going to look great. And we had some great conversation about new technology like Morpheus 8, skin tightening, microneedling. Did you guys do any treatments that focus on skin treatment?
Yeah, and you're right. And I'll answer that in a second. But so what she said is excellent. I usually categorize the problems of people that come into the office in 3: skin problems, loss of volume, and sagginess. So skin problems are treated with skincare, good diet, good exercise, creams, microneedling, radio frequency, lasers, chemical peels. The volume problem is treated with fillers, injectables, Sculptra. The sagginess is treated with surgery, which is my passion. And sometimes you do thread lifting. If you're not a surgeon, you do thread lifting. So we need to address all 3 of them at the same time. And I think as a practice, if you don't treat all 3 at the same time or whatever they need, then you're not doing it good.
It's like building a house. You cannot just use door and wall.
Yeah,
you need other material.
You need windows, you need walls, you need the floor, you need everything. So, and it's the same thing. So you need skincare, skin management, sagginess management, and volume management. And we do all of those at the same time. Successful practices have all of them at the same time.
And then one thing, it interests me that I would like for everyone to pay attention to your skincare. Please pay attention to medical graded skincare. All this beautiful thing that they sell in Sephora or Nordstrom, they're cosmetic. They smell good, they look good, but they don't provide what your skin needs. So what is the skin line that you guys provide?
I don't do the skincare. So you said something really important. Unfortunately, Yalda, I think the problem is that as a general population, people don't know what's what. So I think what you're trying to say is that connect yourself with someone that you trust who is really good, like yourself
And yourself.
and myself, and
Like
some,
just us, just me and
Ju-
Dr.
ju-
Sadaat.
ju- just but someone who's very knowledgeable, who's really good, and has your best interest
Absolutely.
in mind. So that's number one, because it's confusing.
I know.
Listen, I don't know what skincare to use. I'm confused. So I'm a surgeon. I don't know much about skincare. I recognize that, and you know what? I don't do that. So what I do is I have nurses and estheticians and other people in my practice that are specializing in skincare. And if they need surgery, I do the surgery. If they need the filler, I do the filler. If they need the skincare, I'm like,
Send it
I'm
to
not
the
good at
patient,
it.
yeah.
Go to someone who's good at it. And
Kudos to
and,
you.
and I think it's fair, because at the end of the day, we want their outcome to be perfect. We want to have, because why are we doing this?
We love what we do.
There's reward, satisfaction. We want our businesses to get better. Even if you think financially. Obviously, I want to do better for my patients, so they come back.
Yeah, absolutely.
So our goal is to make everything better and do it the right way. And you need to connect with someone who does that wherever you are in the world, and find someone that you trust, has a good reputation, takes care of everything, and has your best interest in mind. Because honestly, I've been doing this for 20 years, and I'm confused sometimes. What filler do I use? What toxin do I use?
There's so many out there.
So it's not fair. It's really, honestly, it's not fair to people. I think you just have to trust the person that you go to and
Do your research.
do your research, and make sure you connect with someone who's decent, who's good, and has your best interest in mind. I hate to say that. Don't think money, think outcome, think good results, and think that this person you trust and is going to be with you is loyal to you. You're loyal to them. It's all about
Absolutely.
loyalty
It's like a friendship. It's
and
like
friendship, relationship for the rest of your life. That's the way I would think about it. And I know it's really expensive. I get it, but this is not somewhere where you're going to cheap out. This is not a pair of shoes or food that you eat. Who cares what you eat, because it's only a day or two. This is your face, this is your beauty, this is your health, and you want to be safe and good. Yeah, and it's priceless.
So Dr. Sadaat, there was one of the lovely providers. She was wondering if you could go a little bit over tear trough and how we can improve the quality of the skin, but also volumization with our peak and fillers. So because there's a lot of talk about tear trough complication, whether
it's become really popular now. So first of all, I think tear trough is it's one of those terms that's just thrown out there. And so the way I look at it is that this part of the face, the mid face, starts from the eyelash all the way to the nasolabial fold. So as a provider, you and I do this. We assess the problem. Is it a skin problem? Is it fat herniating from the inside of the eye and you have bags under your eyes? Do you have loss of volume under the bag?
or festoon, yeah.
Or festoons, as we call those little, crinkly skin that becomes like a triangular shape on the side of your face? Do you have darkness under your eyes? Is the darkness because your skin is really thin? Or sometimes the skin is so see-through that you can see the muscle underneath. Is it because you have sagginess of your mid-face because of your aging process and it's come down? Or is it someone who's worked out a lot and they lost a lot of volume?
A lot of runners.
To answer your question, it is impossible to answer that question because all of those things need to be addressed. And so if it's a volume loss, of course we add a filler. If it's sagginess of the fat, I would do surgery instead, because you don't want to add filler to fat that's there. You actually do surgery to remove the fat. If the face has drooped down and you have significant sagginess of your mid face, then you would do surgery by doing a facelift. So, and then if it's a skin problem, then you do skin treatment, laser resurfacing, fractionated CO2. Sometimes you do radio frequency, sometimes you do chemical peel, skincare products. So again, going back, you need to come in, be evaluated by the right person, someone that you trust, someone that has your best interest in, because all of us are different. your under eye is different than mine, and if somebody treats you and me the same,
That's wrong.
it doesn't work out.
Absolutely. Yes.
We have a question.
Make sure when you go see your provider, get to know them first. I always sometimes even suggest, hey, get a second consultation, get a second opinion. Just don't do it because I'm telling you.
Good point.
Do your own research. And this is your face, and my piece of advice would be absolutely go to someone who values education, who values collaboration. Again, back to Dr. Sadaat, he's very big when it comes to education. He teaches, but he also learns, and I love that about him. So
I learn more than I teach. Every time I teach.
It's incredible, yeah.
There was another question. I know
Yes.
there's so many questions, so hopefully we can get through some of them. So go ahead.
Someone asked, do you tailor the filler to match the patient's natural beauty?
Pardon?
Do you tailor the filler to match the patient's natural beauty?
So do we tailor the filler to match somebody's natural beauty? Of course we do. So there's a bunch of different people that out there. Unfortunately, there's some that just want to exaggerate everything. I think most of us that are in this industry, and that's why you really don't see it, because the good results you don't see. The good results are the ones that you enhance the face, you do the filler, you do the toxin, you do the surgery, you do the laser, but you cannot tell what was done. There is no sign of intervention on the face. You look at the face, you can't tell if anything was done. But if you look at their pictures before and after, they just look 5 years younger, 10 years younger. So you're reversing the aging process, or you changing somebody's features. Sometimes we do change somebody's features. If they have a small chin, you're improving it. If the nose has a big bump, you're improving it. But we're doing it in such a natural way that you cannot tell anything was done. And therefore we are improving somebody's natural beauty to make sure that they look still like themselves. You want their wife, husband, kids, boyfriend, whatever, significant others. You want to make sure that they don't feel like it's a different person. You want them to be exactly the same people.
You just want to enhance their beauty.
That is our number one primary goal, to make them look better without any sign of intervention.
You would see a lot of fillers. I would use lips, and there was a good discussion about lips dysmorphia. And I believe that there are, some providers that they're responsible for this, because there has to be a time to say no to the patient.
Right.
It has to be a time that enough is enough. Because I understand some providers like to also make money, but I think it doesn't have to do anything with the dollar amount, with the money, because I think at the end goes back to the patient's safety and also the natural look.
And I think some also, this is a tough market.
This is a tough market.
We have to be really strong, because
say no.
we get pushed by patients. They want more and more. They look overfilled, and they come and they want. I have a lot of I'm in Beverly Hills, so I have these patients coming in. I want big cheeks, the Maleficent look, and sometimes you just gotta say no.
You just have to say no.
Yes, so
absolutely. I think as a provider, you have to be, respectful of that beautiful anatomy. You cannot stretch those lips for the voice. You have to respect.
We have to respect. So
any other questions?
How are we doing with time?
Yes.
5 more minutes.
Okay, so I think we should talk about temples.
Yes.
Another
guys.
hot topic in this industry
Yes.
are temples.
Guys. Many people talk about that.
Yes,
like,
it's
why?
been ignored. People don't pay attention to it. Maybe the hair covers it
Yes,
and you don't see it. I mean, look at your beautiful hair
Guys.
covering your temples.
You see?
But honestly, a sign of a beautiful face, especially in a female, I'm just picking a female just because of time. It's a reverse triangle. So you want it to be wider on top and narrower at the bottom. That makes it more
V-shaped.
V-shaped, like a heart. And I think a sign of the aging process is actually a triangle, where you lose volume in your temples,
You become heavy, boxy on the lower
and the mid face and the cheeks droop down, and you get wider. And so they become square face, heavy bottom, loss of volume here. So one of the biggest things that we're focusing on, and we've realized that would make a big difference, is actually adding volume to the temples. And there are 3 ways of doing that.
One is cannula.
Well, no, I'm talking about 3 different products. You're right,
Perfect.
3 different. So there's HA, hyaluronic acid, which is temporary, but it's really good and safe. There's Sculptra. Sculptra is polyl-lactic acid. It's a biostimulant that makes collagen, and I think in my mind is probably the best one.
It's beautiful.
And then last one, there's an implant, believe it or not. There's a temple implant that you can put in there when we do brow lifting and you want to add volume. There's an implant you can do there that's permanent. So I just want to tell you what's available.
So yeah, don't forget about your temple, you guys, because when you become hollow and you become extremely boxy and heavy on your lower face, that's a sign of aging. I would highly recommend take care of your cheeks, but don't keep adding to those cheeks because then it's not going to be balanced anymore. You have to pay attention to those hollow temple because it will also give you support when it comes to your brow area. So
I'm laughing because we're at Four Seasons at LAMCA, Beverly Hills.
I think 200 other providers around
and
us.
they keep passing by us. I'm like, what are you guys doing here? And we're like, oh, hey, how's it going? So if we're saying hello, that's why, because I see all familiar faces.
Well,
wish you were here. It's beautiful. The weather is perfect. Education is amazing. Friends are here.
Could we quickly go about your cadaver course? When is the next cadaver course that you're having?
Okay, good question. Well, I do a lot of training. As you know, I have about 8 of them scheduled in the next few months. I have one on Sunday here actually it's at SLS Hotel. I have one in San Francisco in a few months, in a few weeks. I have another one coming up in Philadelphia.
So feel free to DM us, guys.
Yes.
It's so important. We appreciate your time.
We have one at Peninsula Hotel in July.
Yeah, guys.
High risk area. So
Stay tuned.
for those of you who are interested in education and this, go to our DMs. My website has a list of all the educational courses that I'm doing. And I don't know what you're doing, but go to her DM and whatever she's doing, and she's on the forefront of stuff. Unfortunately, we don't see each other enough, but now hopefully with COVID finished, we can connect more and see each other more.
So we're the Persian gangster at your service. DM us. We love you guys. Amen.
Persian gang. There you go. That's good.